Welcome back to Journey to 600. Today we're going to talk about the anatomy of the shoulder. We'll go through the joints of the shoulder, osteokinematics, arthrokinematics, muscles of the rotator cuff, and ligaments of the glenohumeral joint. So for joints, the shoulder joint itself is the glenohumeral joint, which is made up of the humerus and the scapula. But along with the shoulder, you have the AC joint or the acromioclavicular joint, which is made up of the scapula and the clavicle. And then you also have the sternoclavicular joint, which is composed of the sternum and the clavicle. Not quite pictured here, but it is right on the other end of the clavicle in that picture. So starting off with motions, we're going to go through the osteokinematics first. So there are 6 motions of the shoulder, but they kind of have opposites. Osteokinematics differ from arthrokinematics. In general, osteokinematics means bone movement, and arthrokinematics are joint movement. So when you talk about joint movement, that's what's happening at the joint surface itself. But examples of osteokinematics are flexion and extension. So that's what this man is doing in this first picture on the left. So as he's raising overhead, that's flexion, and as he moves back down, that's extension. Abduction is that for the middle picture there in the purple. And abduction is when the arm moves away from the body in the frontal plane. Adduction is when the arm moves back towards the body, like you're adding the arm back in the frontal plane. External rotation, and this can be with the arm at side or with the shoulder abducted at 90 degrees. But external rotation is when that forearm moves away from the body. And internal rotation is when the arm moves back towards the body if your elbow is at your side. And then that very last picture on the right kind of has all those movements together on that one picture. Flexion, extension, abduction, adduction, and internal and external rotation. Again, going back over arthrokinematics. So arthrokinematics are described more as that roll and glide. And the rule of arthrokinematics are easy when you know the rules and the shapes of the bones. So you have 2 choices on thinking about how the bone or the joint surface is moving. And it just depends on the shape of the bone. So you have either the concave bone is moving on the convex bone, or the convex bone is moving on the concave bone. So when you have concave moving on convex, the roll and glide are in the same direction. When you have convex on concave, the roll and glide are in opposite directions. For example, for open chain movements of the shoulder, it will be a convex on concave movement because the humerus is convex, moving on the concave glenoid. So for most of the open chain shoulder movements, it'll be convex on concave, meaning the roll and glide are in opposite directions. The picture on the left describes the convex moving on concave, so the roll and glide are in opposite directions. And then the picture on the right is when concave is moving on convex, so that is the roll and glide are in the same direction. So specifically for motions at the shoulder, you also look at it in what plane it's moving in. So arthrokinematics for shoulder flexion and shoulder extension. Technically, there is no roll and slide. It's just spinning for shoulder flexion and extension. We do learn about glides that improve shoulder flexion and extension. So for flexion, the humerus is rolling anterior, sliding posterior on the glenoid. For extension, the humerus is rolling posterior, sliding anterior. Again, that's because the convex humerus is moving on the concave glenoid. For motions such as abduction and adduction, this motion is in the frontal plane, so this picture is from the frontal view. For shoulder abduction, the humerus rolls superiorly and glides inferiorly on the glenoid. shoulder adduction, the convex humerus rolls inferior and glides superior. For the motion internal and external rotation, this is in the transverse plane. For external rotation, the convex humerus rolls posterior and slides anterior. For internal rotation, the convex humerus rolls anterior and slides posterior on the glenoid. For muscles of the shoulder, there are a lot of them, so we're just going to focus on muscles of the rotator cuff, which is just 4. Rotator cuff muscles are typically remembered by the acronym SITS, S-I-T-S. So supraspinatus is in charge of the initiation of shoulder abduction. The infraspinatus is responsible for shoulder external rotation. Teres minor is also responsible for shoulder external rotation, and the subscapularis is in charge of shoulder internal rotation. So the supraspinatus is located above the spine of the scapula. The infraspinatus is the muscle below the spine of the scapula, and teres minor is inferior and a little bit deeper than the infraspinatus. And the subscapularis is on the anterior part of the scapula. Next, we're going to talk about the ligaments of the shoulder, and there's going to be 2 slides, so here we'll cover the first 3. So ligament number 1 is the coracohumeral ligament, and it prevents excessive inferior translation with your arm at your side. So this is the red ligament here. So imagine where it's at. So it's going to prevent that humerus from dropping inferiorly and prevent inferior translation. So if it prevents inferior translation, this is also going to resist abduction, because with abduction, the humerus slides superior and glides inferior. So this is going to prevent the humerus from abducting too much. The superior glenohumeral ligament is the blue ligament here. It also prevents excessive inferior translation with arm at side. And that's because the way that they're connecting the humerus and the scapula together, they're kind of both preventing that excessive inferior translation. So the superior glenohumeral ligament will also resist abduction. The middle glenohumeral ligament, it is now even more inferior. It's the green one. So it's actually going to prevent excessive anterior translation with the arm in abduction. So if it's going to prevent anterior translation, that's going to resist external rotation at 0. Because with external rotation, you are rolling, the humerus is rolling posterior and gliding anterior. The inferior glenohumeral ligament, but it has 3 bands, and the 3 bands have different functions. The posterior band of the inferior glenohumeral joint, which is the purple-ish one, and it's going to prevent excessive posterior translation. So if it prevents excessive posterior translation, it's going to help resist internal rotation. For internal rotation, the convex humerus rolls anterior and slides posterior on the glenoid. The inferior band of the inferior glenohumeral ligament is the orange color, and it's going to prevent excessive inferior translation as you elevate the arm. We've already talked about inferior translation, so that is going to prevent or resist abduction. The anterior band of the inferior glenohumeral ligament is going to prevent excessive anterior translation at 90 degrees abduction. So this is going to resist external rotation at 90 degrees. This is super important because it's going to prevent that anterior dislocation. But if you dislocate your shoulder, this anterior band of the inferior glenohumeral ligament is definitely going to be involved. That is all for anatomy of the shoulder. We'll get to our first practice question. Which of the following shoulder ligaments resists internal rotation? A, middle glenohumeral ligament, B, coracohumeral ligament, C, anterior band of inferior glenohumeral ligament, D, posterior band of inferior glenohumeral ligament. I'll give you a moment to answer. Please pause if you're not ready to review. This question is asking for which one resists internal rotation. So with internal rotation, the convex humerus rolls anterior and slides posterior, but you're really looking for something that resists posterior translation. So the middle glenohumeral ligament prevents anterior translation, so that's going to be for external rotation. B prevents excessive inferior translation, so that's going to be abduction. C, the anterior band of the inferior glenohumeral ligament resists or prevents excessive anterior translation. So again, that's going to be for external rotation. But the posterior band is going to prevent excessive posterior translation, therefore it will resist internal rotation. So D, posterior band of the inferior glenohumeral ligament is the correct answer. Practice question number 2. A patient presents to the clinic with limited shoulder range of motion. Upon assessment, you note a grade 2 inferior glide of the shoulder. Which of the following shoulder range of motion is limited? A, flexion, B, external rotation, C, abduction, or D, internal rotation. I'll give you a moment to answer. Please pause if you're not ready to review. So this patient's coming in with limited shoulder range of motion. So you know that, period. But then it says you note a grade 2 inferior glide. So what does grade 2 mean? Grade 2 means hypomobility. And now you're looking at the inferior glide specifically. So with what motion do you need an inferior glide? Well, with flexion, that's roll anterior, slide posterior. So that is not right. B, external rotation, that's roll posterior, slide anterior. No. Abduction is roll superior, slide inferior. Yes, so C looks like the best answer. D is roll anterior, slide posterior. So D is not right. So C is the best answer, abduction, because the convex humerus rolls superiorly and glides inferiorly on the glenoid. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.